in this session, we are going to have three sequence session that actually simultaneously talking about the first, of course, talking about the BCM, how to make the preparations, and then the second one is how we can still working during the disasters. Yeah, in this case, the COVID-19 pandemic. Yeah, and then the third, we're going to hear about how the new normal and its implication on supply chains. Yeah, be ready on after the if or hope soon that this COVID pandemic will be passing away. Of course, it's not going to be easy for us to going back to normal. There might be going to be a new normal. Yeah. So after this, we are going to hear from the second presentations from Natalie Keynote. Yeah, Natalie is supervising health scientist at Keynote Chemist and chair of the board of direction in Pittsburgh Sitzer Fellows Program, who has interest in public health, disease control, yeah, and prevention and sustainability. Previously, she was a fellow in the Albert Switzer Fellowship in 2013 to 14. Was a research specialist in University of Pittsburgh and many more. And now he has a mastering of public health, yeah, in infectious disease and microbiology in 2014. Yeah.
Hi everyone. My name is Natalie Egnott, and I'm an epidemiologist with Cardinal. I've been working over the last couple of months with my colleagues to address our clients' issues related to COVID-19. And I'm going to talk to you today a little bit about my experience providing occupational support to maintain worker health and minimize disruption throughout the COVID-19 pandemic. And before I get started, as an epidemiologist, I want to just go over a couple of epidemiological updates and facts to make sure that we're all on the same page. As I'm sure most of you are aware, the SARS coronavirus 2 that is currently circulating the globe is a member of the coronavirus group. These coronaviruses are known to cause disease in mammals and in birds, and they are responsible for causing symptoms similar to the common cold, but they can also result in very severe disease like what we're seeing right now with COVID-19. Examples similar to this coronavirus that have jumped from animals to humans and caused quite a bit of damage in the past include the SARS coronavirus 1, or the SARS outbreak in 2003, and then also the Middle Eastern respiratory syndrome coronavirus, which has intermittently caused disease in the Middle East. And just to clarify, SARS coronavirus 2 is the virus that is circulating, but I'm probably just going to refer to everything as COVID-19. That is the disease that is caused by SARS coronavirus 2, but that's really what people have been using to refer to both the virus and the disease most frequently. So this figure just depicts the cumulative case counts for a number of selected countries that have been affected by COVID-19. The purpose of something like this, and what we aim to learn from a graph like this, is what's happening in terms of flattening the curve in terms of cumulative case count. So as the number of new cases per day begins to slow or reduce to zero, this cumulative case count flattens. And the hope is that all of these countries, which they seem to be on the trajectory towards flattening that curve, that they will end up flattening and we will have no new cases in these places once they've gained control over the epidemic. And you can see based on this figure that some geographic areas, some countries have had more success in flattening that curve than others. This is influenced by a lot of different things, including but not limited to the resources available, the size of the population, the demographics of the population, the response time and the response strategies. But as you can see from this figure, most countries are on the trajectory towards flattening the curve presently. And when I talk about flattening that curve, I know that's a phrase that has been thrown around a lot lately. What's the point of that? What's the intention of that, other than just reducing the number of new cases ultimately and gaining control of the epidemic? Well, the hope in a time like this is that we can really not only flatten that curve that I showed on the last page, which is our cumulative number of cases, but also to try and spread out this potential peak of new infections. In an uncontrolled setting, without any sort of, any protocols or interventions in place to try and reduce transmission or spread of disease, we can see and witness a really striking increase in the number of cases in something like this new novel coronavirus. And that can result in a number of severe cases that overburden a healthcare system. And if we overburden our healthcare systems and don't have adequate resources, people don't get the care that they need, and that results in excess mortality. So the hope right now is to try and learn as much as we can and use the interventions that we have in our toolkit at this point in time to try and flatten out that peak so that we aren't overwhelming our healthcare systems in any different setting. And the main techniques that people are using right now, that different governments are using, honestly, is really social distancing. So a lot of policies are geared towards increasing social distancing and reducing the likelihood that there will be transmission of the coronavirus throughout the population. As I'm sure some of you have experienced firsthand, social distancing is not a really targeted method to try and control an epidemic. It has a lot of negative consequences. If you think of if you're feeling sick and you take a medication and you have negative side effects, on a larger scale, social distancing is the intervention we're using to combat COVID-19, and it's having a lot of negative side effects. So it's had negative side effects on the economy, negative side effects on people's quality of life and mental health. There are a lot of different negative effects of using an approach like this to try and get control of the epidemic. But based on what we know about the disease at this time, this is really the best technique that we have. And hopefully, as we continue to learn and gain control over the epidemic and reduce transmission, social distancing will buy us some time to continue learning and continue testing and figuring out exactly where the disease is spread, so that in the future we can use more targeted measures and targeted strategies to try and mitigate the negative effects of this virus. And in terms of what really informs our strategies, so what is influencing our leaders to make this decision that we need to practice social distancing right now, and what will help them determine in the future what strategies might be most appropriate when and most effective when. Those are really based on mathematical models. And these models are just mathematical simulations of very complex and adaptive problems like pandemics. These models have to acknowledge that there are a lot of dynamic systems at play. It's not just the population out there getting exposed and then going to the hospital. It's not quite so simple. There are lots of different groups that and different systems that interact within a society and within a population. There's also feedback loops and time delays and downstream effects. As we're learning, that changes our behavior, and that can change the projection for different models. And there's also different stakeholders in the population, so people who have different interests and different motivations, and that may influence projections as well. But ultimately, most of these models are based on our understanding of three main groups: those who are susceptible to being infected, those who are presently infected, and then those who have recovered or died from infection. So those people who are no longer able to give it to somebody else or able to receive the infection themselves. And our assumptions based on the different populations in different areas and regions and different sophistication levels of these models will vary in terms of how frequently and how often those susceptible and infected and recovered people may interact with one another. Because it's probably not just assumed that everybody has the same likelihood of coming into contact with one another. The important thing to remember with these models is that while they're really useful, they're just simplified representations of reality. So none of them is perfect. None of them is a crystal ball that tells us the future. There's a quote that statisticians and epidemiologists like to use frequently, and that is that all models are wrong, but some of them are useful. So when leaders are making decisions about how to combat COVID-19 on a national level or at a regional or state level or local level, it's probably based on several different models that they're taking into account that help them predict what's coming down the line. And these models are really a critical aspect of policymaking, and they're is influencing our supply chains and our different businesses and workers across all of our countries. So I want to start talking about some of my experience and the work that I've been doing lately for clients. And in order to do that, I just want to first give a big thank you to the team that I've been working with at Cardno Chemris. We have a really great multidisciplinary team of individuals with expertise in emergency preparedness and response, health and safety, virology and bioaerosols, epidemiology, and microbiology. And it has been a real pleasure to learn from all of my colleagues and work with them on this, and they helped me put together this presentation. So in terms of the clients that we have been helping, we've worked with quite a variety of different groups that have different needs. Some of our clients presently are involved in media and television, so news organizations with a global presence and reporters kind of scattered across the globe. International e-cigarette manufacturers who are shipping from one country to several different countries, global food and beverage manufacturers, and then also the energy sector. And you know, most of these clients that we've been working with have been considered essential business, so they haven't been able to shut down in many locations. So they're really worried about finding a way to keep their workers safe and to try and minimize disruption, even though the world around them is quite disrupted. And in terms of what we've performed so far and what we've offered to these clients, this list is not inclusive, but these are really kind of the main components of what we've been offering. And that includes weekly updates to try and make sure that business leaders are fully informed on the COVID-19 situation, infection control plans, case management plans for when they have a case among their staff or a suspected case among their staff, cleaning and disinfection plans, travel guidelines, question and answer sessions for employees. So we do those either via webinar or via email, and then providing worker field assignment best practices. So giving recommendations to workers that have to be out in the field because they're considered essential, and then also helping leaders conduct these risk assessments and hazard matrices to determine whether or not their field workers truly are essential and they need to be potentially putting themselves at risk to conduct their work. And then also we're helping several clients with return to normal business operations procedures so that when they get the green light from their local government officials that they can return to normal business, they are completely ready to do so. And we found that there are several different components of a quality COVID-19 response from our clients. And I'm going to go through each of these in a little bit of detail and give a couple examples of a few of these, but it mostly includes facility and product handling, recommendations related to worker hygiene, good communication and regular communication from management, leadership and management involvement and a real understanding of their responsibilities in this situation, case management plans, travel restrictions and guidelines, and then workplace continuity plans. So in terms of leadership and management, we found that it's really critical that at the very start, responsibilities of different individuals are identified and there's clear roles for people so that that eliminates the possibility of indecision and procrastination and response. If everybody has a clear idea of who needs to do what when, then things can move more smoothly and people are willing to and ready to adapt rather than try and panic and react in the case of an emergency. We've also found that there needs to be a clear communication strategy employed. So staff need to know when they're going to be communicated with and who is going to be communicating with them on a regular basis. So it's important for leadership and management to identify that mouthpiece that's going to be talking to the organization. So not just workers, but also other stakeholders. Leadership and management is also responsible for ensuring that employees are protected and that they are checked in on. This may be in some settings making sure that there's proper protective equipment or training or compliance among the workforce. But if people are working from home, that might look a little different. So leaders are still encouraged to reach out to workers and conduct wellness checks. It may still be a very stressful time for their employees, but just in a different way than somebody who may be out in the field. And then also leadership and management are responsible for any necessary reporting of events that occur at their facilities. And one thing that I think is really tied to leadership and communication is communication. So, or leadership and management is communication. There needs to be a framework identified and developed and implemented very early on in emergency response. Like I said, so that people know within a company who's going to be communicating with them and when. Regular, clear, concise communication is really most effective. And we found that it's most effective if leaders are only relaying pertinent or really the most important information to their stakeholders, so that they aren't overwhelming people with too much information and they kind of get communication fatigue. You want to make sure that you're sending out just enough to keep people fully informed, but not overwhelm them at any point in time. And it also needs to be communicated to workers where they can find information to stay up to date on the company's policies and the situation and how the response is going. You don't want to get into a situation where leadership is doing a good job of coming up with all of these plans and response strategies, but workers are not receiving the message, so they're not able to actually follow those guidelines. So it's important to have something like a website or a regular communication where workers can find the appropriate information. And then we found that it's really helpful for workers to have a web page or a resource to go to ask questions. There are definitely, we've seen patterns of frequently asked questions across different sectors that we've worked with. And it really just helps to assuage fears among the workforce if they know where to go to get their questions answered, and there's less misinformation and less wondering about what's going on and what does the future hold. And then one area that I've been really involved in our response is case management plans. So this is what an employer can do if they are in a situation where they believe that there is a positive or suspected case of COVID-19 among their staff, or if they are suspect that one of their employees has been exposed or potentially exposed to someone else with COVID-19, whether that is a coworker or a family member or a household member, or if they have somebody among their staff who is suffering from common respiratory symptoms. What do you do even if you don't suspect that it is this coronavirus? So we've been making decision trees and working very closely with business leaders and their human resource departments so that they are equipped to make these decisions on their own and know when to bring in. Not every company has access to medical personnel. Some of the companies that we work with do have medical personnel on site, but most don't. So how do we make sure that they're empowered to make the right decisions to protect their employee health, to refer them to testing or to medical guidance when needed, and when to quarantine employees, and when to let somebody know that they're probably okay and they can continue working as normal. And then these case management plans also, in addition to addressing the employee's health directly, also incorporate disinfection of workspaces and what needs to be done if there is a case of COVID in a workspace, and then any necessary reporting that needs to happen. So to the local government or local health department, if they need to know in terms of, there's different requirements in different areas. So we try and keep our employers or our clients up on that so that they know if they need to report anything that is happening among their employees. And then something that's really important in terms of just following at all times, not just in a pandemic situation, is worker hygiene and protections. And these worker hygiene recommendations and plans that we've been offering to clients are really based on foundational principles in infection prevention that don't change from virus to bacteria to any microbial pathogen. They're really effective measures that time and time again have helped mitigate the spread of different pathogens. So these are just common things like hand hygiene and social distancing, trying to find ways to compromise with our clients about making sure that they're following social distance guidelines. So in the United States right now, it's recommended that everybody stays 2 meters or 6 feet apart from one another. And in some high density workspaces or workspaces where people may be on field assignments and need to work together or need to be in close quarters, that may not be feasible. So how do we come up with ways to make sure that workers are safe and practicing safe, social distancing guidelines and behavioral practices when their job may require them to break some of these rules? So that's one of the areas that I think we've been pretty helpful in over the last couple of weeks as well. And I just want to give an example of something that has really influenced our recommendations about worker hygiene and protections in the US. And I'm sure that this is occurring elsewhere, but what we've learned in peer-reviewed scientific publications over the last couple of weeks is really interesting about the possibility for transmission of this coronavirus. So some of you may be aware, in terms of when you are infected with a virus and then develop symptoms later, there's really two main periods here that we classify. The incubation period is the time when you are infected, but you're not experiencing any signs or symptoms of that disease. And then the symptomatic period is when you start to feel sick. And we find that people who are symptomatic and they're coughing, they're sneezing, they're most likely to be shedding that virus and transmitting it to other people. So if you give them a nasal swab or swab their throat, they'll have the highest viral load or count of the virus, RNA, or this coronavirus, able to shed at that point in time. However, what's really unique about what we're finding about this specific coronavirus is that people have had detectable virus in them even if they're not experiencing symptoms. And it seems like people who are not currently experiencing symptoms, but about to experience symptoms, so they're pre-symptomatic, are quite likely to transmit the virus to other people. So we're seeing there's pretty substantial viral shedding in the pre-symptomatic period, such that the World Health Organization has said that pre-symptomatic people are really a major part of driving the pandemic, because they're feeling okay, they're out and about, they're interacting with others, they don't know that they're sick yet, and they're able to give the disease to other people. And we have seen some accounts where the only explanation is that somebody who was asymptomatic, so never developed symptoms and never felt sick, was able to give it to other people in their family, but that's much more rare than people who are pre-symptomatic and transmitting it to other people. And how that's influenced our guidelines is that we found that one way, originally in the United States, and it's definitely different in a lot of other places, it was not recommended for people to wear masks. The CDC was worried that if people were wearing masks, they would be more likely to touch their face and have the virus. If it had been on their hand, it can get into a mucous membrane and they can become infected. But what we found with these, the likelihood of people to, give the virus to other people if they're not feeling sick yet, is that it's really helpful to people it's really helpful to try and slow the spread if we encourage people to wear masks, so that if they are sick but they're feeling okay, if they cough or talk to another person, that they're not able to infect the other person. So this is based on most recent evidence, and it's an example of how the CDC has changed their policy, or the US CDC has changed their policy from no masks, recommending no masks, to recommending that everybody who goes outside and could be interacting with another person wear a mask. So this is something we've really had to adapt in terms of recommendations to our clients. And again, the mask is not intended to protect people who are wearing the mask. It's really intended to protect people from getting sick from someone who is wearing the mask. So the mask can stop you from giving the virus to somebody else. And we have a lot of issues here with our clients who now are wondering where they're going to be able to get masks. We have a shortage. So where can they get the appropriate materials to make masks for their employees? And what is the most effective fabric to try and reduce the spread? And if they have workers that are working in a really hot environment, is it safe for them to have their face covered at all times? Or if they're working as welders and there could be sparks that could catch a mask on fire, what do you do in that circumstance? So we've been working on adapting our recommendations to fit the CDC guidelines, but also make sure that we're meeting our clients where they are and able to help them in their unique circumstances. And these masks are really recommended in addition to all of the other guidelines and precautions that are still in place, like social distancing, avoiding touching one's face, and only going out in public if necessary. And then one other area that we have been able to really help some of our clients with is understanding different travel restrictions and guidelines and helping them come up with their own risk assessments and weigh out decisions based on federal and local guidelines, and then also the spread of disease in different regions, to try and help them understand if it is worth the risk for their employees to travel. And if their employees do travel, what does that mean when they get back? Or if they travel to a different location, are they going to have to quarantine for 14 days before they can do their job? And, is that something that is worth it to them? So I think we've been a tremendous help to several of our clients in this way, but it's really, really important that any business leader is aware of all of the different travel restrictions and guidelines that could be influencing and affecting their employees and their ability to get to their job and to also get home safely to their family. We've also done quite a bit of work related to facility and product handling. So, helping people figure out how to sanitize and disinfect facilities. What are the most effective disinfectants for this specific coronavirus, and then also understanding, viral persistence on their products. If they're shipping products, for several weeks, do they have to worry about a product having viable virus on it and then somebody receiving it and getting sick from their products? So helping different companies make sure that their products are safe for their workers to be manufacturing, and then also safe for consumers and customers. And then finally, the last thing that we've been helping with is a return to normal business operations or continuity plans. And this is really to try and help people make sure that they're prepared whenever some of these different local, state, or federal guidelines that may be restricting their business, once those are lifted, that they know exactly what to do to try and get back to normal operations. And we try and develop parameters and variables that determine when they can transition from different stages, when they can transition from response to recovery to just working on preparedness and normal operations again. And a lot of this is based on government guidelines, but also based on tailored to their specific business, and different resources that may be coming available at different times, and the spread locally. If you have an organization that has sites all over the world, they may be able to return to normal business in certain areas sooner rather than others. So in terms of what we've learned, ultimately, there's a lot of unique challenges that COVID-19 has caused, and those unique challenges require unique solutions. This is something that I think to a lot of epidemiologists and public health professionals, this isn't a surprising circumstance, and a lot of us have had training to prepare for something like this, but at the same time, this is entirely new, and no one has really done this before, and no one has tried to fight something like this before. So we're all continuing to learn and try and respond uniquely and be adaptive. But in terms of challenges that we're facing specifically, this is a really high impact pathogen that is just emerging, and we're learning about it every day. So trying to stay abreast of all of the literature and all of the news that is coming out on this topic, so that our clients are most informed and they feel equipped to make the best decisions for themselves and their business is really important. There's also constantly changing government guidelines and mandates. So creating plans that allow our clients to remain flexible in light of these different government guidelines and mandates is really important. Trying to help our clients figure out what rules apply to essential workers and those who have to return to work, because they are critical to, different resources and infrastructure. How to maintain their safety is really at the utmost importance right now. And then another challenge that we've really, seen a lot of is fear and the spread of misinformation. So that's why we have been encouraging our clients to make sure that they are regularly communicating with their staff, but we've also been providing these sort of ask me anything webinars with our subject matter experts so that we can talk directly to our clients' employees, and they can ask any questions that may be concerning them at that time. And then in terms of things like supply chain shortages or necessary PPE, we have experts in industrial hygiene and preparedness that have been writing papers on comparing the efficacy of different options for PPE, and based on what's available at that time, how protected do we think you are? So ultimately, in terms of moving forward, these fundamental infection control practices apply to all workplaces, regardless of the different sector. And it's essential that people are prepared, different clients or companies are prepared for stuff like this. These infection control practices, like I said, are really hallmarks of infection prevention that can be transferred to all different sectors and all different pathogens. So there are some guidelines here that we should all just be adopting generally for the future. And then in terms of moving forward, if a company is just starting to try and figure out their response, it's best to start really conservatively, and like we are with social distancing and shutting things down a bit, maybe a little bit overboard at first, but trying to keep things logical and loosening things up as we go and we have a better handle on the situation. And just being really specific in terms of our control strategies and making sure that there's regular and open communication and education with all workers and stakeholders within an organization. And remembering that general and vague recommendations are really difficult in a crisis. So trying to be as specific as possible with communication will help us all. And then always thinking about the future. So while we are kind of in this emergency situation right now, it's essential that we know what's coming down the line in terms of next month or the next 3 months, how we're going to be able to adapt our approach and how we may be already need to be thinking about returning to normal and rising to that challenge. So that's all that I have. Thank you so much for your time, and I'm looking forward to answering your questions soon.